Good afternoon. My name is Mariah Scales, and I'm a research assistant at Sister Love Incorporated. My presentation, I Don't Know Anything About It, Awareness, Knowledge, and Perceptions of Medication Abortion Among Georgia's Black and Latinx Communities, will explore Phase 1 findings from the community-based research project, Georgia Access to Medication Abortion. To the left, we have the logos of some of our collaborators and funders. At the top, we have the logo of Sister Love, followed by the Center of Reproductive Health Research in the Southeast logo. We have the logo of Emory University and Georgia State University, followed by the logo for the Society of Family Planning Research Fund. At the conclusion of the presentation, participants should be able to assess the level of knowledge and awareness of medication abortion among Black and Latinx communities in Georgia, describe perceptions of medication abortion among Black and Latinx communities in Georgia, and finally, formulate solutions for increasing culturally sensitive and accessible medication abortion for Black and Latinx communities in Georgia. A brief outline of the presentation, I will give an overview of the Georgia Access to Medication Abortion Project, followed by an overview of the research methods, our Phase 1 emerging themes, results, our conclusion, and hopefully there will be time for a Q&A. Awesome. So the Georgia Access to Medication Abortion Project. Medication abortion is an important sexual and reproductive health service, but little is known about medication abortion awareness, knowledge, and perceptions among Black and Latinx communities. The Georgia Access to Medication Abortion Project, or GAMA for short, is a community-based research project led by Sister Love Incorporated with partnership and support from Emory University's Center for Reproductive Health Research in the Southeast. This project was funded by the Society of Family Planning. The GAMA project seeks to explore the perceptions, experiences, perceived barriers, and facilitators of access to and uptake of medication abortion among Black and Latinx women in Georgia. The aim of the GAMA project is to improve access to medication abortion for Black and Latinx communities in Georgia. And so to the left, we have one of our flyers for our first community event that introduced the GAMA project to our community advisory board as well as interested community members. As I mentioned earlier, I will be focusing on the Phase 1 results of the GAMA project. However, this project was conducted in 3 phases. The GAMA project is a community-based research project with a qualitative methods design. The GAMA project was conducted in 3 phases. The first phase began in late 2018 and consisted of developing a community advisory board and conducting key informant interviews. Phase 2 consisted of conducting 30 individual interviews in 6 focus groups with Black and Latinx women in the Metro Atlanta area. And Phase 3 consisted of community and academic dissemination. In this presentation, I'll be discussing the findings from our Phase 1 key informant interviews. The community-led team from Sister Love and Emory University conducted semi-structured interviews with 10 abortion providers and 10 community-based organization leaders serving Black and Latinx communities in Metro Atlanta. The transcripts were analyzed using the SORT, SIFT, think, and SHIFT protocol for thematic analysis. And to the left, we have an image of the 159 counties in Georgia. The counties that are shaded in red represents the 28 counties in which we drew participants and conducted our research. So for our Phase 1 emerging themes, based on our analysis from our key informant interviews, there were 6 emerging themes that arose. The first was the lack of awareness among clinical providers about Black and Latinx experiences and barriers to medication abortion access. The barriers to medication abortion are intersectional. There is a widespread mistrust of medication abortion due to the mistrust of medicine and science. Abortion restrictions inequitably affect Black and Latinx access. There are promising opportunities for medication abortion integration. And finally, there is a lack of awareness and knowledge of medication abortion among our communities. For the remainder of this presentation, I will be focusing on the last emerging theme. So what do we learn from our phase 1 research? Abortion stigma, particularly silence and lack of awareness around abortion, is a major barrier to medication abortion access. Based on the 10 interviews we conducted with our key informants, it is perceived that there are 4 main factors that influence the level of knowledge and awareness of medication abortion in Black and Latinx communities. And to the left, we have a clip art illustration of 3 individuals standing in front of office supplies, a cabinet, a whiteboard, and a printer, and they are having a conversation. So one of the first themes that arose from our key informant interviews was there was a lack of reproductive health education. Based on the interviews from phase 1, younger women often do not have basic sex and reproductive health education, such as not knowing where their vagina is and how that affects their choices about medication and surgical abortion. And this often showed up in stories about Latinx women and girls. And so I have 2 quotes from 2 abortion providers, and I would like for you all to focus on the bold text. So our first quote from one of our key informants was, "This 15-year-old told her doctor that she didn't know where her vagina is. The doctor came out and had me go back in the room and kind of give her a anatomy, just show her where her vagina is." Another quote from an abortion provider states, "But I would say that in the education level, because they need to understand. Like, I think a lot of people don't necessarily understand what happens when you have a medication abortion. They think it's like you just take a pill and then you're magically not pregnant anymore, but it's not that pleasant. So imagine if they are totally uninformed about that, then there's more that the counselor and physician has to do to make sure they feel comfortable sending their patient on their way." The second theme was the lack of knowledge among our community-based organization leaders concerning medication abortion services and options, Our key informants often told us that many women seeking abortion services were unaware that there was a pill option. So one quote from our community-based organization leader states, "Because like I said, I think with everything, I feel like that lack of access to knowledge really creates one of the biggest barriers there is. I mean, if you don't know it exists, you don't know how to ask for it, you don't know what to look for." And then there's a lack of knowledge amongst our community-based organization leaders. Yeah, I know. So regarding the medication abortion, like I said, it's not something I've ever heard of before. Like, if we don't know as advocates, usually our community doesn't know. And the last theme is that of myths. Our key informants reported needed to field questions from the clients they serve concerning potential consequences of utilizing abortion services. One abortion provider stated, "I mean, they believe in what they believe, and that moral part is usually never discussed because that is, a very individual thing. But it is more like medical questions about the risks. How long does it take? This is a common question I've heard. If they will ever be able to have children again. If their husbands or partners are going to notice." Because we also see a lot of patients who experience coercion at home. So in conclusion, the results of the phase 1 interviews indicate that abortion providers and community-based organization leaders perceive that the lack of reproductive health education, the lack of contraceptive and family planning education, the lack of knowledge among advocacy leaders, and reproductive health myths are the main culprits for the medication abortion knowledge gap among Black and Latinx communities that they serve. Solutions to close this gap knowledge include accessible, comprehensive sex education, research and scholarship that centers and uplifts the voices of Black and Latinx communities, research design that includes community-based organizations, and community dissemination of research in conjunction with academic dissemination of research. And so if you all have further questions or want to learn more about the other phases of the project, My contact information is located on this page, as well as the website concerning the findings for this particular project. If you want to take a screenshot, go ahead. But I want to thank everyone for tuning in to my presentation, and I hope you all learned something new. Thank you.